Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob, and here we go. Any tips of weaning off of blood pressure medication? Excellent question, because I have so many people that are on blood pressure meds and they don't know what to do. So this is what I've discovered over time. Often a lack of magnesium could be one of the reasons that your blood pressure is going up. Plus, you may be consuming too much salt in the form of fast food. You might not be drinking enough water, and you may be underneath stress. See, the whole purpose of a beta blocker is to slow those adrenal glands down. In our practice, we also do correction to the spine. I've seen individuals' blood pressure drop within normal by using spinal adjustments. And remember, I'm in Naples, Florida, and Westlake, Ohio. Dr. Bob, do you think Caprin would affect or bother you if you had stomach ulcers? So Caprin is a product that we use that's excellent for yeast. It's caprylic acid. I really don't know if the Caprin would bother your stomach ulcer. I know a lot of times individuals have ulcers because of bacteria that's inside of their stomach. We usually use Caprin for a yeast issue. You may want to have some other blood tests done to see if you're sensitive to any kind of foods. But Caprin, from my observation, really should not. I'm not saying it won't, but I don't think it really would. Dr. Bob, what causes cyst inside of my eyelid, and how do I prevent it? It just reoccurred, and I don't use makeup, and I clean my eyes every day, and I do warm compresses. Very interesting, because I've had other individuals have chronic eye problems, and often it is due to a food sensitivity. And recently we had someone that eggs were a part of that individual's reason, because it happened to be their weak link in their body, I guess. And we had that individual go off eggs and chicken and poultry, and we used another product called A emulsion, which is vitamin A. They also did warm compresses. We can do a test called the FIT, F-I-T test, to see what your body could be sensitive to. You may also consider a CBC with a differential. We'd be looking to see if you have a virus in your eye with increased lymphocytes. Really good point, by the way, virus. Dr. Bob, hi, I'm wondering if you have any information or something in one of your books about gum recession and what a person can do to help reverse it. In my book, Dr. Bob's Guide to Prevent Surgery, I have a chapter on cataracts. And you might say, what do cataracts have to do with my teeth? It has to do with bone. It has to do with calcium absorption. We know that you should have 10 parts calcium to 4 parts phosphorus. So I recently had an individual, 65 years old. She was concerned about osteoporosis, etc. in her body. So we did an OptiChem profile. We looked at her calcium phosphorus ratio, and she was doing fine. You may consider doing an OptiChem profile so we can evaluate your calcium and phosphorus ratio. 10 parts calcium, 4 parts phosphorus. Dr. Bob, last question. What causes lipomas or fat tumors, and how do you eliminate them? Well, I really can't tell you what causes them, but I do know that liver function is really important. In our practice, we look at individuals' films of their spine, and oftentimes we'll see a large liver. You may consider having liver enzymes done, but I'm making a very bold statement here. Your liver enzymes could be okay, physiologically, not pathologically, but you could still have an enlarged liver. The liver processes fat. I pray that this makes a difference for all of you. I'm Dr. Bob DiMaria.